Cancer. Key facts. Cancer is a leading cause of death worldwide, accounting for nearly 10 million deaths in 2020, or nearly 1 in 6 deaths. The most common cancers are breast, lung, colon, and rectum, and prostate cancers. Around 1/3 of deaths from cancer are due to tobacco use, high body mass index, alcohol consumption, low fruit and vegetable intake, and lack of physical activity. Cancer-causing infections, such as human papillomavirus, HPV, and hepatitis, are responsible for approximately 30% of cancer cases in low and lower middle-income countries. Many cancers can be cured if detected early and treated effectively. Overview. Cancer is a generic term for a large group of diseases that can affect any part of the body. Other terms used are malignant tumors and neoplasms. One defining feature of cancer is the rapid creation of abnormal cells that grow beyond their usual boundaries and which can then invade adjoining parts of the body and spread to other organs. The latter process is referred to as metastasis. Widespread metastases are the primary cause of death from cancer. Causes. Cancer arises from the transformation of normal cells into tumor cells in a multi-stage process that generally progresses from a precancerous lesion to a malignant tumor. These changes are the result of the interaction between a person's genetic factors and 3 categories of external agents, including physical carcinogens, such as ultraviolet and ionizing radiation, chemical carcinogens, such as asbestos, components of tobacco smoke, alcohol, aflatoxin, a food contaminant, and arsenic, a drinking water contaminant, and biological carcinogens, such as infections from certain viruses, bacteria, or parasites. Prevention. Cancer risk can be reduced by living a healthy lifestyle, getting vaccinated against HPV and hepatitis B, if you belong to a group for which vaccination is recommended. Avoiding ultraviolet radiation exposure, which primarily results from exposure to the sun, and artificial tanning devices, and/or using sun protection measures. Ensuring safe and appropriate use of radiation in healthcare, for diagnostic and therapeutic purposes, minimizing occupational exposure to ionizing radiation, and reducing exposure to outdoor air pollution and indoor air pollution. Early detection. Cancer mortality is reduced when cases are detected and treated early. There are 2 components of early detection: early diagnosis and screening. Early diagnosis. When identified early, cancer is more likely to respond to treatment and can result in a greater probability of survival with less morbidity, as well as less expensive treatment. Significant improvements can be made in the lives of cancer patients by detecting cancer early and avoiding delays in care. Screening. Screening aims to identify individuals with findings suggestive of a specific cancer or precancer before they have developed symptoms. When abnormalities are identified during screening, further tests to establish a definitive diagnosis should follow, as should referral for treatment if cancer is proven to be present. Screening programs are effective for some but not all cancer types, and in general are far more complex and resource-intensive than early diagnosis, as they require special equipment and dedicated personnel. Even when screening programs are established, early diagnosis programs are still necessary to identify those cancer cases occurring in people who do not meet the age or risk factor criteria for screening. Examples of screening methods are HPV test, including HPV, DNA and mRNA test, as preferred modality for cervical cancer screening, and mammography screening for breast cancer for women aged 50 to 69 residing in settings with strong or relatively strong health systems. Quality assurance is required for both screening and early diagnosis programs. Symptoms. Signs and symptoms caused by cancer will vary, depending on what part of the body is affected. Some general signs and symptoms associated with, but not specific to, cancer include fatigue, lump or area of thickening that can be felt under the skin, weight changes, including unintended loss or gain, skin changes, such as yellowing, darkening or redness of the skin, sores that won't heal, or changes to existing moles, changes in bowel or bladder habits, persistent cough or trouble breathing, difficulty swallowing, hoarseness, persistent indigestion or discomfort after eating, persistent, unexplained muscle or joint pain, persistent, unexplained fevers or night sweats, unexplained bleeding or bruising. Childhood cancer. Each year, an estimated 400,000 children and adolescents of 0 to 19 years old develop cancer. The most common types of childhood cancers include leukemias, brain cancers, lymphomas and solid tumors, such as neuroblastoma and Wilms tumors. In high-income countries, where comprehensive services are generally accessible, more than 80% of children with cancer are cured. In low- and middle-income countries, LMIC, less than 30% are cured. Childhood cancer cannot generally be prevented or identified through screening. Most childhood cancers can be cured with generic medicines and other forms of treatment, including surgery and radiotherapy. Only 29% of low-income countries report that cancer medicines are generally available to their populations compared to 96% of high-income countries. Treatment. A correct cancer diagnosis is essential for appropriate and effective treatment, because every cancer type requires a specific treatment regimen. Treatment usually includes surgery, radiotherapy, systemic therapy, that is, chemotherapy, hormonal treatments, targeted biological therapies. Proper selection of a treatment regimen takes into consideration both the cancer and the individual being treated. Completion of the treatment protocol in a defined period of time is important to achieve the predicted therapeutic result. Determining the goals of treatment is an important first step. The primary goal is generally to cure cancer or to considerably prolong life. Improving the patient's quality of life is also an important goal. This can be achieved by support for the patient's physical, psychosocial and spiritual well-being and palliative care in terminal stages of cancer. Some of the most common cancer types, such as breast cancer, cervical cancer, oral cancer, and colorectal cancer, have high cure probabilities when detected early and treated according to best practices. Some cancer types, such as testicular seminoma and different types of leukemia and lymphoma in children, also have high cure rates if appropriate treatment is provided, even when cancerous cells are present in other areas of the body. There is, however, a significant variation in treatment availability between countries of different income levels. Comprehensive treatment is reportedly available in more than 90% of high-income countries but less than 15% of low-income countries. Palliative care. Palliative care is treatment to relieve, rather than cure, symptoms and suffering caused by cancer, and to improve the quality of life of patients and their families. Palliative care can help people live more comfortably. It is particularly needed in places with a high proportion of patients in advanced stages of cancer, where there is little chance of cure. Relief from physical, psychosocial, and spiritual problems through palliative care is possible for more than 90% of patients with advanced stages of cancer. Effective public health strategies, comprising community and home-based care, are essential to provide pain relief and palliative care for patients and their families. Improved access to oral morphine is strongly recommended for the treatment of moderate to severe cancer pain, suffered by over 80% of people with cancer in the terminal phase. Disclaimer. Remember, while this video provides valuable insights, it is essential to consult with a healthcare professional for personalized advice and treatment. Let us empower ourselves with knowledge to lead healthier life together. Don't forget to like, subscribe, and share to spread awareness. And last but not the least, we extend our heartfelt gratitude to the World Health Organization, WHO, for graciously providing vital and up-to-date data on cancer for this video.